you may have the question, how can physical therapy help me with my insomnia? Well, insomnia can be a very complicated situation, or it can be a more temporary situation, and it can have many causes, and that needs to get looked at by history and evaluation and a thorough workup. And sometimes a review of your medications also needs to be done by your physician. But the question is, how could physical therapy help me with insomnia? And I'd like to try to answer that for you a little bit. Sometimes, for some people, the system in the brain that keeps you awake during the day and asleep at night gets into a different kind of functioning. For example, if you were in a circumstance where it wasn't safe for you to go to sleep, your brain would switch you into a function which enables you to stay awake so that you're not, keep dozing off. And if you were in a situation where your survival instincts were really kicked in very high in a very stressful situation, again, your brain can shift you out of that normal pattern of awake during the day and sleep at night. The part of the brain, it's very deep, loose network, low in the brainstem, is called the reticular activating system. And this network is has a lot to do with awake and sleep states. We know that when a person is under a lot of stress or has a prior history of very significant stresses, that a current situation can kind of push them over the edge, and they have a very hard time dropping into sleep. So any kind of help for calming down the mind, calming down the thoughts, and getting back some calming in the body can be very helpful. I have experience working with traumatic stress and high stress states and methods that help the body to calm back down again. There are techniques that I have taught people that they can use at home on their own, and I've also worked with very stressed populations of people, like in the Boulder County Jail. I worked in the drug and alcohol recovery program, and there were some people there that had a lot of difficulty with sleeping at night, and they reported that my methods were helpful for them. And I hear that with reasonable frequency from people who I pass these methods on to. Now, I'm not saying that everything I teach people is an absolute panacea and will fix all your problems, but it might be a helpful adjunct. One of the things that's helpful is to settle the body down, settle the mind and the body down by just connecting into the body and to very neutral surroundings. They're neither pushing towards happy thoughts or pushing towards negative thoughts, but right in the middle. So I teach people methods to become aware of with their mind very neutral information, and also I teach people methods of calming that involve experiencing the body in a safe and solid way that slows you down. That might not be very detailed, but hopefully it's not too much information. And if you have any questions about your specific situation, please feel free to call me.